Hey, Margie here. I love discussing things that really can make a difference for your bones. And today we're talking about genistein. And what you'll learn is number one, how genistein can make a difference in your bone health. Number two, how does genistein compare to something like Fosamax? There was actually a head-to-head study, and you'll learn about this and all the research about genistein. And number three, what's the best way to take it and who shouldn't take it? So I'm really excited, and our special guest is Dr. Kim Millman. And Dr. Millman's been on the podcast numerous times before, and she's really a fan favorite, but she's a Stanford, UCSF, USC trained integrative medicine physician and research scientist. But she's been working for over 15 years in a medical practice, helping women with bone loss discover their root causes and really helping them with natural strategies. She also created the Restore and Rebuild 100 Days to Healthier Bones. And together, Dr. Millman and I co-founded the Bone Health Academy, where we're training people to be certified integrative bone health practitioners. Anyway, in this talk, it's filled with great information. Stay tuned. Welcome, Dr. Millman. I'm so excited to have you here. And this topic is so great. And it's something that a lot of people really don't know about. So I'm just so happy that, you're going to delve into it with the research, because both you and I, when we present something, it has to be research based and there has to be evidence so that it makes sense. Why would we recommend someone add this to their regimen? So I'm just so excited. So welcome.
Thank you. Thank you. I'm honored to be here.
So before we get started, I just have to, because sometimes not everybody stays to the whole thing. So I just have to share, I'm so excited. There's two things that Dr. Millman and I are doing that are just so wonderful. And I just wanted to let everybody know about it. So Dr. Millman has an amazing, amazing class called R&R, Restore and Rebuild 100 Days to Healthier Bones. And the next class is starting in March. What day exactly?
March 7th is the first day.
Okay, so this is a program she's been doing for several years now, and oh my gosh, people have improved so much. They've learned so much. It's just been wonderful. I teach two of the classes, so we're going to have information in that. Why don't you give the link, Dr. Millman, for people to learn more about that?
Yeah, it's over at the millmanclinic.com and /R&R, RANDR, right after the Millman Clinic.
And the nice thing is you always have a really good early bird special, and you also give our community and everybody listening to the podcast $100 off. So here's the code. This will all be in the show notes, so don't worry, but it's just happy S26 100. So anyway, if you use that, you'll get an extra $100 off. So that's number one, that this great class is starting in March. And number two, I think some of you know about this, but Dr. Millman and I, we started the Bone Health Academy, and we started a program for practitioners to be certified in this amazing integrative bone health method. And it's been so wonderful. We have so many fabulous practitioners for the first cohort. So we'll be starting a second cohort. And we're just, if you are a practitioner and you really want to learn how, because we can't share all this, there's just two of us, and the world needs you if you're a practitioner. So we want to give you all the things that have worked for Dr. Millman for these years and all the protocols. And it's just been, I am just so fired up about how wonderful it's been, and the practitioners that we have. It's just been fantastic. So if this is at all interesting to you, just go to thebonehealthacademy.com and you can learn more about it. And yeah, so anyway, so those are the two things I just wanted to mention. And what we decided to do is do like a little master class, so that, because we wanted to give you in this podcast, it's not long, we wanted to give you the information so that you can really understand why we both think genistein is something so wonderful, and what the research has showed, and who it can help, and how this could possibly benefit your bones. So is there anything before we start you want to say, Dr. Millman?
I would just say that I know that, a lot of times what I hear from my patients is that Dr. Millman, I can't take one more thing. You know, my pill box is filled, and I can't put one more thing in my pill box. And I just want everyone to take a serious look at Genistein, because it basically, we have some data that we're presenting, that there was a head-to-head trial where Genistein improved bone mineral density as well as Fosamax. And also, it works on two major key root cause drivers, which is estrogen loss and blood sugar. So most postmenopausal women have postmenopausal estrogen loss, and this is a way to buffer against it. And so if you're, I mean, this is a thing that could really be part of the cornerstone of your protocol. And so I just hope that everybody listens to it and then stays on with us, because we're going to give a recap of what you'll learn and just kind of the main takeaway points at the end, and just give Genistein a serious look for the cornerstone of your protocol.
Yeah, and the good thing is, the way you'll see with the supplements and things, you don't have to really add, because there's supplements that combine things. So it's not really that you even have to add a pill. Yeah, the minute I started really learning about the research, I started adding it to my program for me personally. So I've been taking it for quite a while. So anyway, yeah, so we're very excited to present this. And don't worry, you don't have to absorb everything, but we wanted it there for you, so that if you do have to, you see the articles and you see what's going on, so that we both believe knowledge is power. And so we wanted to just give you all the information and the research, so that you see why we think it's such a great thing. Okay, so we're gonna start the masterclass, and then we'll come back.
I'm really excited to be sharing with you today how Genistein rebalances bone. It is something that I recommend to my patients often. We'll start by reviewing bone remodeling mechanisms. And when it comes to having strong, healthy bones, it's all about balance. So there can be too much bone loss, or there can be too little bone formation that is at the heart of why your bones are thinning. So when there's too much bone loss, there's rankle that's often involved, and it's a signaling protein that tells the bones when to break down. And in response to inflammatory proteins or microdamage in the area, rankle, this protein, will stimulate the osteoclasts, or the demolition workers, to start breaking down more bone. This is called the active resorption phase. And this phase typically takes 1 month. Once this cleanup phase is complete, osteoblasts, the cell that lay down new bone, start to become active. And as new bone is built, the rankle signals shut down and the osteoclast activity slows. C-telopeptide, or CTX, is a blood marker that reflects how much bone breakdown is occurring. Higher CTX levels indicate more active bone breakdown. So there can also be too little bone building. And one of the mechanisms that happens here is there's another signaling molecule called sclerostin. And basically, sclerostin slows bone building, and it acts as a brake on the osteoblasts, the cells that build bone, and it reduces their activity and limits how long they stay active. When sclerostin levels are lower, the brake is released, and that allows the osteoblasts to work longer and build bone more effectively. Procollagen type 1 N-terminal propeptide, or P1NP, is a blood marker that reflects how much new bone is being formed. Higher P1NP levels indicate increased bone building. Genistein is an isoflavone. And isoflavones are naturally occurring phytoestrogens found in soybeans, other legumes, and red clover. Genistein is a well-studied isoflavone, most commonly derived from soy. As a phytoestrogen, genistein does not raise estrogen levels. Instead, it interacts with the estrogen receptor, especially the estrogen receptor beta, allowing it to provide gentle, estrogen-like support in tissues such as bone. A double-blind, placebo-controlled randomized trial of postmenopausal women with osteoporosis found that taking 54 milligrams per day of genistein, a glycone, along with calcium and vitamin D for 2 years, led to significant improvements in bone mineral density at the lumbar spine, the total hip, and the femoral neck. By the end of the study, the number of women classified as osteoporotic in the Genistein group dropped from 62 to 18, and this was only 29% of these women. And in contrast, 100% of the women in the placebo group were still osteoporotic. Femoral bone mineral density increased from 0.62 at baseline to 0.68 at 12 months and to 0.70 at 24 months among those women who were osteoporotic and taking Genistein. In contrast, the women who were taking the placebo, their bone mineral density at the femoral neck decreased. And you can see that in the women who were osteopenic, the rise in bone mineral density wasn't significant, and it wasn't as great as those women who were osteoporotic. And again, in the placebo group, the bone mineral density decreased. So these charts illustrate that the rising femoral neck BMD with Genistein and progressive bone loss with the placebo in both women with osteoporosis and osteopenia. In a 2-year study of postmenopausal women receiving steroid treatments, Genistein was compared to the popular bone drug Alendronate or Fosamax. So this was a very interesting study. The bone mineral density at the lumbar spine, femoral neck, and total hip significantly increased in both groups. And in fact, there was no statistically significant difference in the bone mineral density improvement between the two, indicating that Genistein increased bone density to a similar extent as Alendronate over the study period. When looking at bone turnover markers, both Genistein and Alendronate significantly reduced CTX, and this is CTX in the Genistein group, and this is CTX in the Alendronate group. And there was no difference in the reduction of CTX between the groups. And because Alendronate is a known anti-resorptive medication, this suggests that Genistein is acting as an anti-resorptive. Genistein also actually decreased sclerostin, taking the brake off of bone building, and with Alendronate, sclerostin increased, which was strengthening the brake. So by looking at this, we can see that Genistein actually has a dual effect on both the resorption and the formation of bone. Genistein also improved blood sugar and lipids. So Alendronate, the changes in the fasting glucose over time was increasing, and in the Genistein group, fasting glucose went down at 1 year and then stayed lower than baseline at 2 years. Total cholesterol also went down in the Genistein group and came up at the 2-year point. And in contrast, the Alendronate group showed the opposite pattern. Blood sugar rose at both 1 and 2 years, and total cholesterol increased at 1 year and stayed elevated at 2 years. So what makes this especially interesting is that Alendronate has been shown in other studies to improve glucose and improve lipids. But in this particular population, women being treated with steroids, that benefit didn't show up. And steroids are known to worsen insulin resistance and cholesterol, and they may have overridden any potential metabolic benefit from Alendronate. But Genistein, on the other hand, not only improved bone markers, but also showed a more favorable metabolic profile, which matters a lot for long-term bone and cardiovascular health. In fact, in a large meta-analysis from 2025, they found that Genistein significantly improved a wide range of cardiovascular and metabolic risk markers. That included total cholesterol, LDL cholesterol, lipoprotein A, blood pressure, fasting blood sugar, insulin levels, HOMA-IR, which is an insulin resistance marker, and even homocysteine. And it's long been known that Genistein helps with menopausal symptoms like hot flashes and night sweats. But there's also data showing that Genistein improves overall quality of life, including overall health status, life satisfaction, and mood and depressive symptoms. Genistein helps rebalance bone by slowing bone loss and supporting new bone growth. On the bone loss side, genistein reduces rankle, limiting how strongly osteoclasts are activated. This is why CTX levels fall, because bone resorption is brought back into a healthier range. On the bone building side, genistein lowers sclerostin, easing the brake on osteoblasts and allowing bone building cells to stay active longer and improve bone structure. Genistein's hormonal effects come from its action at the estrogen receptor beta, which helps restore protective bone signaling without increasing estrogen levels. Together, these actions support a more natural bone remodeling pattern, reducing excess breakdown while preserving healthy bone formation and flexibility. Multiple meta-analyses confirm these preliminary findings. They consistently show that isoflavones can improve bone mineral density at the lumbar spine, femoral neck, and distal radius in postmenopausal women. This effect is most evident when isoflavones are taken for at least 12 months and when the genistein dose is 50 milligrams per day or higher. It's still unclear whether the bone sites that improve are influenced by years since menopause. Some studies suggest a pattern, but evidence is not definitive. Importantly, the genistein doses associated with these bone benefits are far higher than what can be realistically achieved through soy foods alone. The BMD improvements observed in these meta-analyses required standardizing genistein-containing supplements rather than dietary soy alone. Because genistein has estrogen-like activity, a natural question is whether it could stimulate uterine or breast tissue. Human studies are generally reassuring. In a 3-year trial of genistein glycone, researchers monitored mammographic breast density and endometrial thickness, 2 key markers of tissue stimulation, and found no clinically meaningful adverse changes. Genistein does not increase estrogen levels. Instead, it works at the estrogen receptor, where it shows a strong preference for estrogen receptor beta, the receptor that's more active in bone and blood vessels, rather than estrogen receptor alpha, which drives growth in breast and uterine tissue. Genistein also binds far more weakly than estradiol, which further limits overstimulation. In fact, there is data that genistein may protect against breast and prostate cancer, although the overall data are mixed and not definitive. The practical takeaway is that for most postmenopausal women, current human data do not show concerning breast or uterine stimulation at commonly studied doses. However, for women with a history of hormonally sensitive cancers or complex risk profiles, use of genistein should be a shared decision with a knowledgeable healthcare or oncology team. Genistein is most appropriate for perimenopausal or postmenopausal women with bone loss who also have one or more of the following. Women experience menopausal symptoms such as hot flashes or night sweats, insulin resistance or elevated blood glucose, dyslipidemia, including elevated LDL or total cholesterol, high blood pressure, or those receiving chronic steroid therapy may derive added benefit. Genistein is also appropriate for individuals who need estrogen receptor beta mediated hormonal support but are not candidates for conventional estrogen therapy. Genistein should be used carefully in individuals with a history of hormonally sensitive cancers and only with guidance from an oncology-informed clinician. Genistein is usually unnecessary in women who are on adequately dosed estradiol-based bioidentical hormone replacement therapy, as it is usually redundant. As estradiol is already providing full estrogen receptor signaling needed for bone and metabolic support. Osteoben is a formula that combines calcium, magnesium, genistein glycone, vitamin D, and zinc. It can serve as the cornerstone of your Healthy Bones protocol. Consider taking 2 capsules twice daily, and it does not contain soy. As an alternative, FemGuard HF is a formula that does not contain calcium, magnesium, zinc, or vitamin D, unlike Osteoben. This formula is appropriate for individuals who want the hormonal and bone signaling support of genistein without the additional minerals. Consider taking 2 capsules daily. And I've also provided some pertinent references on genistein safety and its uses.
So that was just so great. So, Dr. Millman, you want to do a little recap because there was a lot of information that you presented.
Yeah, I'd love to. So I think the key thing is that we presented the evidence that there was a head-to-head trial where these were postmenopausal women with osteoporosis, and they were taking steroids. And so, as we know, steroids break the bones down really quickly. And there was a head-to-head trial of genistein plus calcium plus vitamin D against Alendronate, which is Fosamax and calcium and vitamin D. And what they found was that the improvement in bone mineral density at the femoral neck was the same. So there was an improvement with genistein and there was an improvement with Fosamax, and they were the same. So we're literally showing in this particular group that genistein is performing as well as Fosamax at improving the bone mineral density. Now, it did take some period of time, and as you remember, the bones turn over at the lumbar spine turns over at approximately 10% per year. So it literally takes 10 years to um, re regenerate the spine. And so this is why it takes so long to see these improvements. And there was a better improvement at 24 months than there was at 12 months. And really, the significant improvement was seen at 12 months. So this is something that needs to be a long-term commitment. And then there were meta-analyses. Now, some people say, well, that was within people who were taking steroids, and it doesn't apply to most other people. Well, then we have these confirmatory meta-analyses, and there were multiple meta-analyses that I looked at, and I presented a couple of them that still showed that there was an improvement with genistein, and it was at the femoral neck, at the total hip, and at the spine. And so, and also in the distal radius in some populations as well. So we have confirmatory evidence that it's not just in a steroid treated group, but that it's in a larger group. Again, in the meta-analysis, they found that the improvement was best at 12 months and longer, and that if they were looking at isoflavones as a whole, so these are other components besides genistein, but when they looked at genistein specifically, the dose of over 50 milligrams was the proper dose, and 54 milligrams is of genistein, a glycone, and a glycone is the proper form. So it's really important to get that dose, and that would be once a day, long-term commitment, 12, 24 months. CTXs are coming down with genistein, and in the head-to-head trial, they actually showed that sclerostin goes down. Sclerostin is really super interesting because that is the mechanism by which Evenity works, and that's showing that potentially genistein is not only acting as an anti-resorptive with the CTX going down, but also as a helping bone formation with sclerostin going down. So this is showing a dual action, and for this could be good for all kinds of people. We also showed the data that it improves lipids, it improves blood sugar, it improves HOMA-IR, which is an insulin resistance marker. It even improved HSCRP, so it had some metabolic parameters that were improving. And so we're looking at genistein as really not only improving BMD, but also improving blood sugar, and rising blood sugar is also a primary driver of bone loss. So these were kind of the main takeaways, and because it can do so much for you, I think it really should be seriously looked at for adding to your protocol. And we showed of the products that we both endorse. They're both from Designs for Health, and Osteoben has a combination of the proper amount of genistein and glycine, which is 54 milligrams, which is seen in the studies, zinc, which there was actually, I didn't present this, but there was actually another study that showed that having zinc with the genistein improved the efficacy of it. And it has calcium and magnesium and some vitamin D and vitamin K in it. So if you take Osteoben, you don't need to take your CalMag. And it's got 400 milligrams of calcium dimalate. That's exactly the form I recommend. 400 milligrams of magnesium dimalate, exactly the form I recommend. So you could cut out your CalMag and take Osteoben, and you haven't even changed your pill count, and you get genistein in and some zinc and a little bit of vitamin D and a little bit of vitamin K. Not enough vitamin D, not enough vitamin K. You still need to take more, but you could really take Osteoben and not even increase your pill count.
Hey, Margie here. High-quality supplements are a big part of a comprehensive osteoporosis program. To help you, I offer a significant discount every day in my supplement store through FullScript. FullScript has the most extensive catalog of professional-grade supplements and wellness products I've ever found. So all you need to do is go to tinyurl.com. That's tinyurl.com/supplements for less. And you'll get to my FullScript store. And in there, you'll see my favorite bone building supplements. So make sure to check it out. And the link will also be in the show notes. So let's get back to the show. Yeah, I love that. There's so many things. That's what I do. I take 2 in the morning and 2 at at dinner time. So it works, to take those 4 pills, and then I no longer have to take the calcium or the magnesium. So it's really a great thing. The other thing I think is just so interesting, because so many times you go to the doctor and well, they don't always test the CTX, but they're like, okay, Fosamax, that's it for you, or whatever. And you have an option, you can say, besides everything else, and now you have the data that, you know what, I think I'm going to do the exercise, I'm going to do all the other things, the root causes, all the things Dr. Millman and I talk about, and we've seen that are so effective. And also the Genistein, which has been shown to be equivalent to the Fosamax. So I just think it's just another tool, and it's just so effective, which is great. So Dr. Millman, I know that this is part of what you've been seeing. What would you recommend in terms of the CTX, which is, for those who don't know, that's showing the bone breakdown and the osteoclast? When would you recommend, if someone starts the Genistein, when do you usually recommend that they get another CTX?
6 months afterwards, yeah, you would want to have some period of time in order to show that change, but 6 months would probably be enough.
Okay, and a couple other things. So who shouldn't take this, or should definitely, check with their primary care practitioner?
Someone who's on a blood thinner, because phytoestrogens in general can be blood thinners. And there is some evidence that genistein has some antiplatelet effects, which means that the platelets are what helps your blood to clot. And so the platelets don't adhere to each other as well. And so then your blood doesn't clot. So if you're on a blood thinner, you don't want your blood to get too thin. And so you wouldn't want to take genistein. And then if somebody, because it is a phytoestrogen, if you had a hormonally sensitive cancer, like uterine, breast, ovarian, or prostate cancer, you wouldn't want to take genistein. Now, I'm going to couch that and say that I have a couple of patients who are taking genistein and have had one has had a history of uterine cancer, and then one had a history of breast cancer. Both of them cleared it with their naturopathic oncologist. So I am finding that naturopathic oncologists are saying yes, but I would never make that decision on my own as a primary care doctor. I would always want to have the whole team make that decision for that patient, and definitely don't make that decision on your own, but involve the entire team.
Yes, so important. Now, I know you addressed this in the talk, but I know that this question comes up a lot in my community. So, is there any benefit if someone is already on, they're already taking bioidentical hormones and they're already on estrogen? So, what's your thought on that?
Yeah, so I think it's redundant. It's the same mechanism. So, but however, if you're taking straight estradiol, estradiol is going to bind to both the estrogen receptor alpha and estrogen receptor beta. And in the talk, if you remember, beta is really important because that's where we're seeing kind of the good effects of estrogen. We're seeing the bone mineral density improvements. We're seeing the reductions in hot flashes and cognitive and cardiovascular improvements. But then the estrogen receptor alpha, when that gets stimulated, that's where the proliferation of the hormone sensitive tissues are seen. So estradiol is binding both, and the phytoestrogens are binding, including genistein, are binding mainly beta. So it could it could compete with estradiol a little bit at the beta receptor. I just don't think if you really are looking at prioritizing the things that are going to make the most impact in your program, if you're on BHRT, I think it's just a little redundant.
Okay, and what about people who are already on osteoporosis medication? Is there anything that they need to be aware of if they add genistein?
I would think that genistein would be complementary. Like let's say that somebody's on Fosamax, then it's a totally different mechanism. And you get that sclerostin decrease. So it would be complementary to probably everything that they're going to be taking, and it wouldn't interfere. However, again, you may just if somebody's on Fosamax or something like that, I would definitely say add the genistein because it's a different mechanism. But if you're on Evenity or you're on Timlos or you're on Forteo or Prolia, they're different mechanisms. So you might get an increase in it might be complementary, but then again, um, you could you could not do just genistein just in order to streamline your protocol.
Yeah, and I guess always check with your physician or,
Of
yeah,
course, in
whoever
all
you
of this.
yeah, whoever you're working with. And so you did a really wonderful thing because I know people like things in writing, and there's a lot of information in that 15 minutes of the masterclass. So you want to tell everybody what you put together for them?
Yeah, we've got a little handout. It's just the Genistein for Bone Health guide, and you can get it over at my website, themillmanclinic.com/Genistein, and that link is going to be in the show notes. And you just have to just opt in so that you can get a copy of it. And I hope you'll also really look at Restore and Rebuild because I get comments all the time about I have patients come in after they've taken R&R and they're just saying, oh, well, I already know this and I already know that and I've been doing this and I've been doing that, and they talk like little functional medicine doctors. I'm so proud of my students. And
Yeah. So if
and
you're the type of person, I think if you're the type of person that really wants to be knowledgeable and you really want to take this into your hands and really understand, because so often things are missed. So you will learn everything. And it's okay though. It's not overwhelming because you can do it at your own pace and the information is always there so you can go back. But we've picked up so many things and people have made so many improvements from the class. And then if you're a practitioner, because the problem is then a lot of these people who come also want to work one-on-one. So that's where we saw that there was this need. So I was the one who told Dr. Millman about doing that class, but Dr. Millman asked me, this was her idea, about the practitioner program because she just really needed people. We need an army. We need people to work with people one-on-one and to have the tools, have the handouts, have all the resources that they can feel confident. So that's what we've created. So Dr. Millman asked me, and it was an offer I absolutely couldn't refuse. And it's just been so rewarding. I love the people who are in our program, and it's just such a great community, and people are working together, and it's just so great. So if you're interested, if you're a practitioner interested in working with this population and really understanding the protocols, just go to the bonehealthacademy.com. And yeah,
Yeah, and just get on the wait list.
yeah,
We haven't set when our next cohort's going to be, but it's going to be we're finishing our first cohort in the middle of March, and it's going to probably be about 6 to 8 weeks after that, we'll start our next cohort. And we would be just thrilled to have you with us. We're like 1,000% in on this. We want qualified people working with people in this community, and they really, really, really need your help.
yeah. And we keep it really small. We're only taking 30 people. And so, it is a matter of we want the people who can really benefit and the people, so it's not that we just take everybody. So if you are interested, join the wait list because we'll have some other things that will be coming up. So if you're on the wait list, we'll make sure that you'll get an email with any information that anything we'll be doing. All right. So thank you. It's always fun to be with you. And I'm so excited that we thank you for, your efforts in presenting all this information. And I just think, and for everybody listening, I really want to hear down the road, if you start using the Genistein, love to hear feedback. And again, so thank you. Thanks so much, Dr. Millman, for coming.
Yeah, my pleasure.
I hope you enjoyed my interview with Dr. Millman as much as I did. And now you have better understanding about Genistein and how this could be something you may want to add to your bone health program. All the links that we talked about, the link to her R&R course, the link to our practitioner program, and the link to the Genistein handout will all be in the show notes. So thank you so much for tuning in, and I look forward to seeing you on the next episode.